Hello, my name is Leonardo Giampaoli, and I'm a doctor with a specialization in hyperbaric and dive medicine. And today we are going to talk a little bit about hand signaling communication in the hyperbaric chamber. And when do we use this? We are going to do a few examples. And we have this technical guideline that we made where you can find pictures with all the explication and the explanation of the signals and how to do the gestures and everything. So you can look at this guideline in the same link of this video, and on the bottom of this video you can also look the link to download the PDF. So we have more or less 30 different signals that we're going to use, and we are going to start. So we have the most common signal is this one, that is a two-way signal. So the first is a question. When I do it first, I'm asking if you are okay, or if everything is okay. So if you are okay, you have to answer back with this signal also. So this signal means, are you okay? And the second meaning is, I am okay. But if I ask if you are okay and you have a problem, then you have to do a different signal, and that signal will be the figure number 2, and the signal is this. This signal means that you have a problem. Then, okay, I know that you have a problem, then you have to tell me which is that problem. So, for example, the most common problems are my ears. I cannot compensate my ears. Or I have pain in my sinus, okay, so I can signal my sinus. Or I have problem breathing, so I just point my lungs. So, are you okay? No, I'm not okay. I have problem in my ear. Okay, so this is the signal for ear problem, for sinus problem, and for lung problem. Alright? Then we have this signal means that I have a problem with the breathing, or I have no air in the line. That means that the outside operator must check all the valves and everything is open, okay, and working properly. So this sign means no air or problem with the line of the air or gas supply. We have this signal means abort the compression. It also can be used with 2 thumbs up and crossing the arms like this. This means that you have an emergency situation and you need to abort in an emergency procedure the compression. That means a fast decompression to the surface. Of course, we can have the situation where you need to go very quick to the surface, or you have to abort the session, but not that fast. So you can do your safety stop, you can do your decompression stop, and you can, let's say, follow the recommendations on the ascent speed. So this is the sign for abort any session, but with a normal decompression procedure. Okay. Then we have another sign, is this one. It means slow down, okay, in any process that you're doing. For example, if you are doing the compression, you can ask the operator to go slower in the process, so you make this sign, okay? Then we have another sign that means it's like this, and it means go deeper or increase the pressure. In this chamber in Iceland, we talk about depth, because all the gauges are in meters of salt water, and we talk about going deeper or going shallower. So this sign will mean to go deeper. This sign will mean go shallower, or go to the surface, or decrease the pressure. If you want to maintain the same depth, then you have to do this sign, okay? With your hand flat, you just do a movement like this, okay? This means stay at the same level or same depth. If you have an emergency and you need the special attention of the operator or the tender, you have to shake your hand very quickly like this. Okay? This will mean stop. Stop any procedure, stop anything that you are doing and pay attention. If the temperature in the chamber is hot, or you need to change the air or increase the ventilation rate, then we have a signal like this, okay? You just do circle movements like this, and that will mean that you need to increase the ventilation. If you want to refer the compression stop, we talk like this, and we are also using this signal to ask how many time is left in the decompression, okay? This is something specific for the operation in this service. When you need to switch gas, we have a special signal that is like this. With your 2 fingers open, you just do a hand rest like this, okay? So this will mean change the breathing gas. It could be, for example, if I'm breathing air and I'm going to change to oxygen, or I require oxygen, then you do this signal, and with the operator you can communicate, and this is the meaning. If there is any gas leak in the system that you need to check, or you are hearing a gas leak, this is the signal for a small gas leak, okay? If you want to refer to measure the vital signs of the patient, we have this sign, okay? This means measure the vital signs of the patients, or in case the tender is doing that signal, it will mean to the operator to help you counting the time when you are measuring the vital signs of the patient. Also, of course, it is a sign to tell the operator, do not make any noise because I will measure the vital signs of the patient. So we have the signal for the safety stop, and the safety stop is like this, with 2 hands, 1 hand with 5 fingers and the other hand with 3 fingers. So 5 of 5 meters depth and 3 of 3 minutes stop, and we are going to do like this. So this signal will mean safety stop. The safety stop is always at 5 meters depth for 3 minutes, okay? If you want to change that, you make the same signal, but then you can tell the operators by numbers if you want to increase the time of the safety stop, or if you want to do 2 safety stop at different depths, okay? And then we have the signals for every number. So this is number 1, this is number 2, this is number 3, this is number 4, this is number 5. Then with the same hand we can do the number for number 6, number 7, number 8, and number 9. The zero is like this. Do not confuse the OK signal with the 0 signal. It's very different. So to tell numbers, or to show numbers, you have with 1 hand you can do every number that you want, and